Donna Berkelhammer, I'm so excited to talk to you today as a lawyer because so many small businesses are nervous of ramping back up and getting into opening and what's their liability risk. So any tips you can give are going to be welcome today.
Yeah, let me start by saying this is a nightmare. Completely unprecedented in most of our lifetimes. We got here from something that there's no blueprint for, and my strong sense is economically we're going to have to get out of this in a way that there's no blueprint for. We think there's probably going to be a lot of forgiveness and grace all the way around, from hopefully banks and landlords and people you owe money to, because hopefully we are all in this together. And I know it's crazy. So that's number one. Number two, even the government agencies that are in charge of giving us guidelines are only giving us guidelines. There is no specific follow these directions and you're going to be safe roadmap on any of this. So like a lot of things in your business, what we're going to talk about is best practices. From what I've been reading, and I've been reading a lot, if you follow the guidelines that I go through, and Martin's going to give you information at the end where I have written all of this down, where you can click the links and go find the specifics. The best guess we have is if you're following these guidelines, you're going to be able to use that as a defense against employee claims and against customer claims. But they're guidelines. They're not, do this, you'll be okay. So that's the caveat that I'm going through. North Carolina has started opening. We're in phase 1, which is no longer stay at home except for groceries, medical, take care of somebody, take care of animals. Globally kind of large, but essentially where you're stay at home, you're safer at home. Most of North Carolina is in phase 1. Number 1, make sure before you open that you are permitted to open. Some retail is allowed to open right now in phase 1. And today is May 14th, I think.
Yeah,
it's Thursday.
Today, so it will be.
Yeah, so, phase 1, bars and restaurants are still not allowed to have sit-down dining. Most of the entertainment is not allowed. Church services inside the building are not allowed. Also note, though, that some cities or counties have more restrictive guidelines than the state. And what applies is the stricter set. So I live in Durham. Durham has consistently had tighter policies than the state. So you are governed by the most restrictive policies. So when it is permitted for you to open, first thing you need to do is figure out what your level of risk is. The highest categories of risk are people that are dealing directly with COVID-19 patients. Mm-hmm. The second level of risk is people who are dealing with those people that are dealing with the COVID-19. So highest risk are medical providers. Second highest risk is probably, the janitors in the hospital, people who drive the nurses around, that kind of thing. Most of the small businesses here are the lowest level of risk. So where you're going to go to find all these guidelines that I'm talking about is OSHA, which is the Federal Agency for Occupational Safety and Health. They have a lot of guidelines that are written fairly much in English, but they're very broad. You're going to have to figure out what applies to you, and you're going to have to apply a lot of common sense. Figure out, first thing we're going to talk about is protecting your employees, because even if no other employment laws apply to you, because you only have a handful of employees, they are still required to have a safe work environment and safe from COVID-19. How do you do that? You're going to follow these guidelines. And then if there's a problem, you're going to say, I did everything you told me to do. The other problem with all of this is it's, I think, going to be very difficult to prove where somebody got exposed. It's, I believe, 14 days from when you're exposed to when you're going to show symptoms. So, you know, is it exactly 14 days? Were you in multiple places where you could have been exposed? I think that's going to be very difficult because you have to prove the damages. Where did you get exposed? Where did you get sick? Again, we're going to do everything we can to be safe for our employees. First thing, how can you spread them out? Let's social distance, 6 feet or more apart. I have clients that have people that share an office that are making arrangements for people to have separate workspaces. Some municipalities like Durham are requiring face masks when you're in public. I would say look at what your local policies are. There's not a North Carolina requirement that you wear face masks out. It's suggested that that's a good practice, but it is not required. Be sensitive to your employees who want to wear masks. Don't discourage it. Allow them to do it if they want. And if you want to require it, there's nothing that says you can't as an employer, but it's not required that you do that. Think about where your employees gather in groups. Is there a break room? Maybe we don't use the break room right now. Is there a time clock where a lot of people are going to gather at once? Is everybody going to be allowed to use the copy machine, or are we going to designate one person? Are you going to have a sanitizing station or a sign up that says before and after you use the copy machine, wash your hands? Just think about where there is contact and how you can reduce it. Maybe you have staggered start times. So some people come in at 8:15 and 8:30 and 8:45. So everybody's not there at once going through the door at the same time, and you can stagger that. You know, if you have an elevator, what are you going to do about an elevator? I think maybe you're in an office building or small business have an office building. I would talk to your landlord about that. Most of us, I think at this point, have been to the grocery store. So you can see social distancing practices in use. You have signs that remind you we need to social distance. They have physical barriers between the cashier and the customer now. Some grocery stores are one way and they have signs up that show you which way to go. So your number one thing is think about the environment. Can you manipulate the environment, spread people out, let people work at home, stagger shifts so that you don't have as many people in the same place? That's called an engineering solution. You may want to require that your employees take their temperature at home before they come in, and if they have a fever, they don't come in. Mm-hmm. You may want to have more hand washing opportunities. You may want to have hand sanitizer. You also might want some policies such as, you know, if you're running a fever, don't come home. This is the new way we're going to do things. We're only going to have one person answer the phone, you know, at the front desk, and nobody else is allowed at the front desk.
Right. So basically what I understand is traditionally having policies that they ramp up after they become employed often were harder to enforce, but I think this would be more of an exception in showing you made best practices. So if they, you know, you can say, here's our new policy. I would think just sitting down and reading it with everyone or going over it as a secondary and having it as a new probably is a good minimizing liability risk act. Is that right?
Actually do it before they come back. I would think
good.
About all of this first and have something you write. It can be, hey, excited to have everyone back. I want to keep everybody safe. Here's how we're going to do things for right now. And have them sign it and send it back to you, have ability to answer questions. You also need to be sensitive to employees that are not comfortable coming back. And if you're not big enough to have Americans with Disabilities Act. There's nothing formal you need to do, but what I encourage everybody to do is go through the process as if the ADA applied to you, which means talk to your employee and figure out exactly what their concern is and see if you can come to a reasonable accommodation for that particular employee and still go within your workflow. Can you give them a separate space that nobody else goes in? Can you let them wear a mask? Do you need to have everybody wear a mask because you've got employees that are older or somebody that has underlying health concerns? Mm-hmm. But figure out exactly what their problem is and see if there's an easy way you can accommodate that. You don't have to, but like I said, we all need to have a little bit of grace.
That's excellent. The other thing is, what do you do about customers coming into a store? One example of one of the many businesses I've been in over the years is like a collectibles antique shop where literally I can stretch my hands out and touch both sides of the store. That's the type of business. I've seen many of it. And, what's your advice of that, and also handling it carefully, because people often don't take a coaching at the front door well. Everyone's under stress and they're kind of more volatile.
I agree. I think it's very difficult for a small business. You want to protect yourself. You want to protect your customers. You want to protect your employees. And some of what we're doing is marketing. I'm marketing that I have a safe business. Mm-hmm. There are stores we go to now where they count how many people are in there. Mm-hmm. And don't let more than a certain amount in. And I think that's probably what a small space business needs to do is, and I don't know how many people is too many, but maybe you only take customers by appointment only. Mm-hmm. I know of a thrift store right now or consignment store that they are letting people in by appointment so that they know how many people are in there and it's controllable for them.
I love this because this can be a marketing tool to help get people aware of you. Find your rules and say, here's what we're doing. Just like the idea I recommended to one of my favorite Indian family-run restaurants, why don't you go reservations only at first? Where you can only have enough that you have enough space and distance in your smaller place, which is easier to control the number of employees there. I mean, it's actually easier to schedule than we have a buffet all day.
Right. And I just saw, I think it was a bed and breakfast restaurant in Virginia that put mannequins dressed in period dress at some of the tables. So it looked like there were people there, but it social distanced the rest of the tables. I thought that was kind of fun.
What about documenting things just so that if there's a record and something occurred, because in so many other legal cases, your advice and other good attorneys say, document, at least try to have a log in case something gets brought before a judge. You can go, well, I made best practices and here's what we've done. What's your views on that and how they should do it? Should be handwritten on the computer? What?
Well, absolutely. We talked about if you have new policies, communicate them upfront to your employees, have them sign it. If there's problems, just document. Like if you have somebody that refuses to come in and you have a conversation, I don't know that how you document it matters so much. You want it to look like you did it in real time and you didn't get sued and then came up with a log. So, if you're, do your best effort, have your employees sign and date things. If you're having problems with people, you should be keeping a personnel record. I will say, though, that if there are health concerns, you need to keep those in a separate file from their personnel file.
Oh, good point.
Health things go separately, and that has personal information that's different than employment information. And some people that could go through their employee file shouldn't see their health records. So keep all that separate. I would have signs up everywhere with your policies so that it's not a surprise to anybody. I'll tell you, the sign people and the video people right now that are doing marketing videos for the companies that are reopening are killing it.
Right. Yeah, even the people making little arrows for the floor and everything else. I think that's really good. And also, like you said, just watch what the norm is in the area and learn. I tell people in the class, listen on the news of where people are going, look at this person who's not safe and make sure you're not getting caught being captured with that, because everybody's a reporter now.
Yeah. And the other thing we haven't touched on is cleaning.
Oh, yes.
There are some guidelines on OSHA and EPA. Those are not very user-friendly. I just spent 15 minutes on the EPA website trying to figure out what products were killing coronavirus. Most of the Lysol products are. You can make a solution with bleach and it'll tell you the proportions of bleach and water. Make sure you wear gloves. Make sure your space is ventilated, and read the instructions, because most of these you spray them on and you have to leave them on for a certain amount of time to get the disinfecting, anywhere from a minute to, I don't know, 2 or 3 minutes. So spray it and leave it and wipe it however long you're supposed to. So it's not just use this and spray it, but read the directions. Story of life, right?
Sure.
So think about what are commonly touched items in your place of business. Door handles, light switches, telephones, desks, the table in the break room. I don't know what you do in the collectible shop, because a lot of things are touched.
Mm-hmm.
I think as your employees, either they wear gloves, and make sure you're trained on how to wear gloves, because just wearing them all the time isn't really what you do. You need to not cross-contaminate things. So there's videos on that on YouTube. All right, there goes the coworker. Sorry.
That's right. Well, that's part of the work from home. So we did that deliberately so they knew that you were with them working from home here. Okay, so that's really important. And so that we could have a sign, please talk to staff if you want to see something closer.
Exactly.
Or something like that. So start walking through, and I think just imagine you're at the highest risk person and you're a customer, and kind of map out your environment as well. My friend Whitney Hill's offering education on touchless ways to accept money. I mean, I never thought when I'm getting $1 out and giving it, I just might have contaminated myself and moving it.
Money is some of the dirtiest substances that you touch. Absolutely.
And even the credit card. I was just somewhere, I handed them the credit card. I thought it'd be really nice if I could have slotted it with a little machine there and not had to at least hand it to someone and hand it back. And I asked them, and they said, we're getting a whole new booth with a shield and a different way of taking money. So think about all those and map them out is so important. And I think what I'm taking away from this is, one, put yourself in the shoes of someone who might be a customer, might be highly vulnerable, and imagine they're coming in. And what's their experience interacting with you? And are there ways where you can minimize the exposure or make best practices? The other thing you said was just have policies and make them clear before they come.
And follow them. That is always important, but it is super important right now. If you have a policy, make sure you are actually following what you said you were going to do.
Yeah, it's funny you said that, because in my training class, I found somebody that said the front door said all employees must wear masks, customers do not require, and they're taking a picture of an employee stocking without a mask. Mm-hmm. That would not be good PR to get on the nightly news.
Exactly.
So when you have policies, I think important to have consequences you can actually execute too, because there are liability risk in that as well.
Mm-hmm.
What are some other things you think for a lot of the people I'm interacting with in North Carolina. I mean, I just want to tell you, some small towns, they are hurting, they're crippled. There was one town I trained where they just don't have a case yet. So imagine being in a town, watching your town literally collapse before your eyes, and you know it's dangerous, but you don't have any examples to operate on. So there's a lot of pain in these small businesses that I think isn't being heard as well.
Yeah, I think be ready to go when it's time to go. Be thoughtful, and remember that when things open up, probably there's going to be a rush of people that are keyed up, stir crazy. I think it's, again, we need some grace and we need to find our way. But hopefully people come beat your doors down and want to be there. And I think most people, if you're clear up front what your policy is, I'm only letting 5 people in, call ahead for an appointment. Some people might be able to do video tours. The realtors in Durham are doing video showings where they're on Facebook Live or something and walking through the house. So there may be ways that you can augment your business. So think about how you're going to do it, be deliberate, and follow what you say you're going to do. That's my best advice. I think consistency
is so important. Don't get a policy you can't execute with consequences. And I do want to tell you, as someone who ran a Radio Shack years ago, a smile and politeness will get you a long way. Listening and concern, the temperament of how you approach is so important. I told you I had talked to a number of malpractice attorneys, and I said, what would happen if doctors just talked to people? And most of them said they'd be out of business in a pretty short period of time. So compassion and caring and listening really does reduce the exception. And then we have problems, people that have just problems that have been amplified by it being inside. And you're like another attorney told me, one is when you meet a client and you think they're crazy, give them their money back and get away politely as fast as possible. And I know that sounds harsh, but I'll never forget that as a tip. And in my business, I've had cases where, not that I thought they were crazy, but they had something bigger than I could handle or service. And I said, let's stop now, and was nice about it. I think that still is very important here. Do you any comments on that?
I agree wholeheartedly. I think we just gotta connect with our own humanity right now.
Yeah.
And be patient with each other. Because like I said, this is a nightmare. It is unprecedented, and we're gonna have to give each other a hand up and help each other get through it.
This was excellent. Well, Donna, I know you are available for hire. I've worked with you before. I've recommended you and had great feedback. Would you tell them how you offer services if they go, I just want to pay and run this by an attorney, because this is one of your wheelhouse of offerings?
Yes, I can certainly help you with policies, either employees or just general business. Most of the time, you just email me or call me. We will figure out the scope of work, and it will be a flat rate. I can't tell you what it'll be till I know what I need to do. But Martin's going to send you a link that has my blog on it,
it'll be below.
And it'll have all my contact information. And the firm name is Legal Direction.
And Donna, you've been excellent. You've come and spoke to my social media management class. We still have that video is required watching, and great resource. I highly recommend you. I think you're terrific. You give very high value. I just want to tell people, the degree, the research, the time, I understand where every penny of that money goes, because you're putting your name behind what you say, and it's really important that you give people something they can stand on in an area that's like random earthquakes with the terrain changing daily.
Yeah, it's crazy.
Yeah,
it is crazy.
And this is so good to hear from you. That it is changing target. Work together.
Yes, absolutely.
Excellent. Thank you, Donna. This was terrific. I appreciate it.
Thanks for inviting me, Martin.